How many languages do you know?
So I know Marathi, I can speak Punjabi and English and Hindi, and my son is forcing me to learn French or Russian.
15 years of experience. Did you see a change in the concerns with which women are now coming to you?
It can cause you to have period issues, it can cause painful periods, it can cause you to have infertility issues. Ko bhunna hai, masale, you deep fry, deep saute, everything. So a lot of your vitamins and the nutrition value of the food reduces. So definitely the vegetarian diet is deficient in proteins. Whether you are a man or a woman, if you have muscles, you need protein. Children as young as 7, 8, 9, 10 are being diagnosed with anemia. So these are some of the very basic reasons that cause females to experience urinary incontinence.
So, thank you, Dr. Balvin, for making it to living well. And thanks for making your time. It's a rainy day outside, but you still made it. Thank you. Thank you.
Thank you so much, sir, for having me. And you've traveled all the way from Gurgaon to meet me, so it's my pleasure.
It's actually for our champs who are all watching us. I think one of the feedbacks we received was that whenever we give them information right from the source, which is the doctors, because you are the source of medical knowledge, I think a lot of products, lot of supplements really make sense, and the talk that happens outside, I don't want to give it a dirty name of trash talk, but I think there is some sensibility whenever we hear doctors say things. I think that's the request, and that's why we're doing this. So thanks a lot. So we'll directly jump in. I was going through your profile, and something that stuck out, Dr. Balvin, even though we're doing the interview in Mohali, is like a lot of places had influence of Maharashtra. What's the story there?
So I am born and brought up in Maharashtra. So to the extent that sometimes if I'm telling people that I'm from Maharashtra, it's like, aap Maharashtrian ho ya Punjabi ho? So I'm like, no, people are born outside Punjab also. So I'm born there. And I have had most of my education and schooling, everything there. And then I got married to my husband. Then we moved to Delhi, and now I have settled in Mohali.
That's one of the questions, right? Why Mohali? I mean, you could have had settled and probably set up practice in Delhi, Mumbai, or Bangalore. Why Mohali?
So why Mohali? Because this is to connect with my in-laws. They are from Gurdaspur, which is a town in, it's a big place in Punjab.
Yeah.
But due to work reasons, they shifted to Karnataka. So my husband is born in Karnataka. And then when we thought of a common place where everybody would be happy, so we thought that they've spent majority of their lifetime outside their ancestral homes. So we did not want to settle in Gurdaspur. That's why we chose Mohali, because it's a good place. Tri-City is one of the loveliest places, beautiful city, cleanliness, and work culture was also good. So we chose Mohali as the
Yeah, it's
place.
called City Beautiful, Chandigarh, I think.
Yeah, absolutely. You go out on the roads, and once you've traveled here, and maybe you just go to any other road and you'll be like, let's go back. We don't want to travel outside Chandigarh on a road. It's very organized, very beautiful. You can breathe the air, you can feel it so clean. So that's absolutely there.
You'd actually worked as a professor also in Maharashtra.
I'll correct you. It's not professor, as a lecturer.
It's a lecturer.
Yeah, in the initial days of my career.
And I mean, that would have been a practice probably of 7 years or 8 years, probably 10 years.
So that is like our residency is there. And
Huh.
after that, we have a time period of a year or two. And that was like for that much time. After that, I have moved out in like private practice.
And when you do that, when you shift cities, I always keep hearing from doctors, it's always tough to shift cities. You have a patient pool that you have to create from scratch, and then there are those connections. How do you manage? And you are saying you had shifted 3 cities, probably from Mumbai or Pune to Delhi.
Pune to Delhi and
Delhi
then
to
to Mohali.
Mohali.
No, you're absolutely right. Whenever anybody goes to a new place, you have to start from scratch in terms of your professional and your social life. But somehow I've been blessed to be associated with like beautiful and very good work culture wise places. Wherever I have worked in all the corporates and private hospitals, they were very welcoming, and I think I do good work. So
No, that's evident. That's evident. I think a lot of good word is there everywhere. So
you should not become Mia Mithu. I'm sorry, but I added that.
no, that's it. I think that adds in. I think that's what confidence is at the end of the day. So one of the things again, these 3 different places, and as doctors, you have to be proficient in local language. So how many languages do you know?
So I know Marathi because it was like the 3rd language at school. I can speak Punjabi and English and Hindi. And my son is forcing me to learn French or Russian, but I don't know how it's going to help me. But yeah, I can at least speak these languages. that way.
And that's good. So you're fully proficient in Marathi.
Yes, if I come across patients here in Mohali also who have shifted here because IT people keep moving. So I'm in the habit of the names, and since we've stayed at so many places, I can understand from the person's name to what language or what place they might belong to. So when I'm talking to them and when I just tell them ki तुम्ही महाराष्ट्रातून आले या तुम्ही तिकडे राहतात, and they just look at my face कि ये मुंह में से क्या निकला, what did you just speak? So of course, I mean, maybe my accent would go rustic because I'm not using it, but I can hold a conversation for 5 to 10 minutes maybe.
That's brilliant. I think I also met some doctors, Punjabi doctors. That's the wrong thing. Doctors from Punjab. And they're in Tamil Nadu. I mean, they had done their PG in PGI Chandigarh, and then they would go be in Chennai, and then within 1 year they would pick up the language and they would speak much better Tamil than even the people who are staying there.
So this is important because when you are practicing medicine,
Yeah.
it's not just about the patient coming and you advising. You have to connect with them. That bond can only be there when the person gains confidence in you. And one way of getting confidence is when you connect in some form. So of course your native place or language is something which gives a wonderful connect.
Absolutely. I mean, that makes it a lot more difficult, and I think a lot more respect to your profession or people practicing your profession, that you have to do that and still be successful.
No, I think you just fall into it because आपको अगर बात करनी है तो you have to learn it, but eventually you realize that this is very important.
Okay, we'll now jump into, I think, somewhere the professional space. 15 years of experience. Did you see a change in the, I would say, the concerns with which women are now coming to you in the last 15 years, or is it the same?
No, there's a lot of difference. When I was doing my residency, I've done my residency from GMCH Nagpur. So, of course, I mean, it's a government hospital. The type of concerns there are very basic, pregnancy, the complications associated with pregnancy, certain gynecological issues that females face of fibroids and all such things. But now, when I see the patients, pregnancy, gynec issues, period problems are always going to be there because that's what a female majority of them have. But now a lot of people, they come forward with awareness issues. For example, when you talk about the various kinds of diseases other than these, they are so much worried about the various kinds of cancers. Why? Somebody in their family has had an episode and they don't want to be there and then it be detected. So they are wanting to undergo certain tests so that they can prevent the development. So they want to undergo screening tests. Another thing is about the vaccinations. So a lot of awareness is created by the government also for the human papilloma virus vaccine, the HPV vaccine, which causes cervical cancer in females. So I do have people coming. In fact, I do have college girls also coming without their parents. Because nowadays finances is not such a big problem. I mean, everybody is carrying an iPhone. They have their various facilities. So they are not really thinking that are we going to spend on this? They have made up their mind. They just want to know about the details and they want to go ahead. So these definitely are the changes. Again, infertility. Previously, it used to be like people never wanted to discuss infertility. Ki log kya kahenge? It was the reason for marriages to break. But I have seen people coming forward, and one thing I want to add to this is that husbands have changed. The perspective has changed from their point of view that I mean, it was always thought that female is responsible for infertility. But in today's time, even when we are doing IVF and ICSI procedures, it's almost a 50-50% contribution from the male and female partners. So this is a very good, I'm not saying that you suffer from the disease, but yes, the outlook has changed, which of course has its own pros and cons. So of course there is a vast change in the type of consultations that we face.
So one of the things you talked about is fibroids, right? I think, is it related to PCOS and stuff like that?
No, sir. A fibroid is if, like I explained to the patients in the OPD, कि आपके चेहरे पे मस्सा बन जाता है. That's just a small outgrowth of skin there. Similarly, the uterus or the reproductive system, the uterus is the main part. It has multiple parts. One of which is the muscle, since we are always dealing with muscles. So the muscle of the uterus develops a lump. In 99.9% cases, this is benign. Benign means it's non-cancerous, but it's just there. So it's a fibroid is a space-occupying lesion in the wall of the uterus. What a fibroid does is, it can be silent. It might not cause any trouble at all. or it can cause you to have period issues, it can cause painful periods, it can cause you to have infertility issues. So these are some of the problems related to a fibroid.
What is a PCOS then?
PCOS is again, it's a complex of problems. The full form is polycystic ovarian syndrome.
Yeah.
And there is another form which is polycystic ovarian disease. So when we're talking about the disease, it is restricted to the reproductive organs or the, but there are a set of symptoms: irregular periods, scanty periods, development of cystic or the big pakawa pimples kind, acne, hair growth in females in the male pattern, for example on the face, on the upper body, or getting coarse male kind hair in females, that is hirsutism, various degrees of that, and infertility. When you talk about polycystic ovarian syndrome, females who have PCOD are at a higher risk of association of other systems of the body. For example, they are more prone to develop diabetes when you compare to the general population at a younger age. Obesity, heart disease. So when it is a systemic involvement, then it becomes something called as PCOS.
So PCOS, because we keep hearing a lot of comments nowadays, or a lot of our own customers keep calling us, asking us about, do you have something for PCOS? Or actually we have our in-house dietitian and a nutritionist, and we provide consultations free of cost.
Okay.
A lot of our nutritionist time goes in explaining to people that this is how you can handle your PCOS, PCOD. Are you seeing that happening? Because we had seen this growth in PCOS related queries in the last 1 year or so.
So the kind of lifestyle that we are in, nothing is really pure. Everything is adulterated, number one. Two, sedentary lifestyle. You don't really have time to cook healthy meals all the time. So, you just grab a packet of something, packaged food on the go, and you just munch on it. So, junk food, lack of exercise, and of course, there is some degree of genetics involved in it also. But basically, when you talk of PCOD, we always label it as a lifestyle disorder or a disease. And first step is definitely lifestyle modification. So, definitely a nutritionist, a dietitian, and exercise plays a very important role. But the crux of the disease is there is insulin resistance, as is seen in diabetes. So we have to have those similar changes in terms of your diet. You need to have a carbohydrate restricted diet. I will not say deficient diet, because you need carbs for your body, for your functioning. Also, majority of these people are young people. Not, I mean, they even to the extent of like 14, 16 years, girls are getting these issues. So you can't ask them to stop eating.
Yeah.
But it has to be a carbohydrate restricted diet, more of proteins and more of fiber in your diet, coupled with exercise.
So can you unbundle this insulin resistance as a concept? Because I keep hearing that from a lot of doctors, and in some of the podcasts even I had seen that insulin resistance is the root cause for a lot of issues, which is PCOS, or there is this maybe issues that are relating to that HPO axis, hypothalamus, pituitary and ovarian system axis, that I heard.
So insulin resistance is that insulin is being secreted in your body. Diabetes is when there is deficiency of insulin, but insulin resistance is when it is unable to perform its function,
which is digesting of carbohydrates.
Utilizing the glucose, because carbohydrates are ultimately being broken down to glucose in the body. Now, when it is not going to be utilized, excessive sugars or excessive glucose is again a stress on the body. So it initiates a reverse organism and reverse pathway, and you hear people saying that weight gain was caused because of PCOD, but they don't understand that weight gain was initiated because of the insulin resistance, because it was not being utilized, and then it becomes a vicious cycle. So you have to go to, it's the molecular level where insulin is acting on the receptors. Many a times we even use medicines which are used in diabetics in very severe forms of PCOD and PCOS, so their insulin acceptance or utilization of glucose in the body becomes better.
Understood. So what we are saying is, if we restrict the carbohydrates,
yes,
then your insulin adapts to it, or breaks down sugars better.
No, insulin does not adapt to it. It's basically there is excessive sugar which is there. There's a hormonal imbalance which is created, and when it will be corrected, because the hormonal milieu has to be such that there is utilization. So when you are saying carbohydrate restricted, first of all, what is there in the body has to be utilized. So in a way, when you are asking the person to undergo certain type of diets, the diet is just having more of proteins and fiber so that the carbohydrate can be obtained from what is there in the body. And once that person has attained that target weight, which is according to their BMI, of course they're going to have carbohydrates. So the insulin resistance is being corrected through the diets.
Understood.
And
Understood.
of course, insulin is there in your body, but it's unable to perform its function of utilization of glucose.
Yes, yes. And then you said that all these are related. One, obesity or...
Yes.
And then you said...
Obesity, heart disease, diabetes itself.
Diabetes. And also you said PCOS has a relation to infertility as such.
Yes, PCOS has a relation to infertility because when you talk of the ovaries, PCOS is polycystic ovarian syndrome or disease. Ovaries have the basic function of production of eggs, and the egg is going to be available for fertilization by a sperm to result in a pregnancy.
Yes.
So people suffering from PCOD have failure of production of eggs. There is something called as anovulation. There is no egg production. So that is how it is related to infertility. Because if there is no egg formation, there is no. I mean, one of the gametes or half of a pregnancy cannot be there because you need a sperm and you need an egg.
Understood.
Sometimes if the degree of PCOD is very severe, which is evident on hormonal tests, the quality of eggs also might not be so good. So basically there is you can understand that there is a basic level of inflammation. Inflammatory markers, they rise because of all these, excess of glucose, the stress factors rise. And for a pregnancy to stay, there has to be a hormonal milieu which will be, like we said, that pregnancy is a kind of there is suppression of immunity.
Understood.
So that the male factor is not rejected because, the half of the chromosome set is coming from the males. So the inflammation or the inflammatory markers are on the rise in PCOD and diabetes and all such conditions. This is also one of the factors. So loss of eggs or no availability of eggs, quality of eggs, and the state of rise in inflammatory markers, all of these in a way have implication on fertility, that is, there is reduced fertility.
And there is something you said which is inflammation, right? And this is one word that is very freely thrown around, I feel. I think it's also interchangeably used by a lot of people between weight gain and inflammation. Are they the same or are they different?
No, weight gain is different. I mean, you cannot label it as inflammation. Many a time people come कि हमारा ESR बढ़ा हुआ है. ESR is again an indicator of it is an inflammatory marker. So it is usually seen in patients who have chronic conditions. For example, they may be having chronic joint pains or various kinds of chronic conditions like किसी को arthritis है या basic किसी को heart disease है. These are the conditions where the ESR is raised. So these are markers of inflammation. Obesity is not really inflammation. Obesity is your excessive intake or loss of activity. There is no utilization. But again, too much weight loss or weight gain, it is creating a stress on your body. So then the inflammatory markers will rise, your cortisol levels will rise, and then again your axis will, that is when your HPO se zyada HPA, the hypothalamo pituitary adrenal axis will be changed, and then your cycles, not just period cycles but your body cycles change, because of which again the weight keh lo, activity keh lo aap, or stress factors. Stress is acting on your arteries, stress is acting on your brain, on your neurons, on everything. So the hormones or the basic एक आप कहते हो ना environment जो body का है. Why do people go to gym? Of course to look good, but it releases something called as endorphins. So endorphins are the good factors and the feel good factors. So कोई gym से निकलता है इतना खुश क्यों होता है? Because of various factors, but because endorphins are released. So for them to be released, and not just them, but good atmosphere or good environment is important for overall functioning of the body.
So one key takeaway is, if someone is getting right kind of food, someone is able to manage their insulin resistance better, then the probability of better health or the probability of ill health from your heart diseases or from lifestyle conditions like diabetes or infertility conditions all come down just by managing your diet and exercising regularly.
Absolutely, sir.
And on that, when we are talking about protein rich and fiber rich diets, I mean, Indian foods, let's be honest, we are the vegetarianism is decently high in our country. So do we get right amount of supplementation on protein? Do women get right amount of supplementation?
Well, sorry to say we don't get. Now, like I was just talking to you some time back that I have started going to the gym recently.
Yeah.
So till that time also, my husband would keep telling me your protein intake is very less. And I was like, why do I need protein? ठीक है, घर चल रहा है, काम चल रहा है, मैं चल रही हूँ, good enough. But now that I've started going to the gym, I feel my muscles are so sore, and I mean, when I'm doing the workout, sometimes my muscles are, like shivering type हो रहा है. So my trainer is like, ma'am, कितना protein है? So I'm like, 2 कटोरी दाल. He's like, कैसे होगा 2 कटोरी दाल से? So a vegetarian diet is deficient in protein, the quality of the protein and the content. अब आप पूरी डोंगा भर के दाल तो खा नहीं सकते. You're going to eat in portions.
Yes.
Other than that, protein is also heat sensitive.
Yes.
Majority of the nutrients or the type of cooking that the Indian style is, उसको भुनना है, मसाले, you deep fry, deep saute, everything. So a lot of your vitamins and the nutrition value of the food reduces. So definitely the vegetarian diet is deficient in proteins.
And on that, I also want to ask a specific question, right? And this is also, I think, a myth buster. People think protein is only for muscles, but everything in our body, whether it is our skin, whether it is our heart, like you said, reproductive system, and even our nails and hair,
Yes.
they're all made of protein, right? I mean, a form of protein at the end of the day.
Absolutely. Whether you are a man or a woman, आपको muscle है.
Yes.
If you have muscles, you need protein. It's just according to the kind of work or labor that you are doing, your protein requirement changes. But there is something called as a recommended daily intake of everything that you eat, your calcium, your iron, your protein, everything, fat also for that matter. So protein is needed for everybody.
Yes.
Protein is necessary for your muscles, protein is necessary for your hair growth, protein is important, like any activity needs protein.
Yes.
So अगर आप ये कहोगे कि नहीं सिर्फ men are going to eat protein, you are wrong in saying that. Females also need protein.
Yes.
But it's according to your weight. Like I said, your weight and the kind of work you do.
And one other thing, because we are talking about essential vitamins and also minerals, and women, if you see, during the menstruation time, you lose a lot of blood. And I also think, even despite that, genetically Indians are a lot more prone to being anemic, if I'm not wrong. And also the incidence of osteoporosis or calcium deficiency and bone issues are much higher. Do you still see that continuing, or are diets getting better? Is there more awareness?
When I'll talk about everything that you said. So first of all, anemia.
Anemia, yeah.
The kind of practices that we have, for example, दूध के साथ हम कुछ भी खा लेते हैं. So one thing is important is that iron and calcium cannot work together. So consumption should be such that it is utilized well. For example, iron needs vitamin C for absorption.
Yes.
So अगर आप कोई जूस ले रहे हो या अगर आपने बीटरूट खाना है, आपने अनार खाना है, if you make a big bowl, it needs to have vitamin C in it in the form of maybe आप टैबलेट ले सकते हो, आप नींबू निचोड़ सकते हो, fruits डाल सकते हो, कीवी, मौसम्बी, whatever. Orange. Avla, gooseberry is like the richest source.
Yes.
I remember my mother, she would have this big jar of avle ka murabba. I was like, it's so toxically sweet, I could never eat it in my life. But yes, I have a taste for, sour and tangy things. But that is the richest source, so cheap, nutritious, and if you have a sweet tooth, tasty also. So one thing is that the correct consumption. Secondly, when you talk about the Indian scenario, like you mentioned that change in the awareness. So now I get people who ask me that what is the right age for supplements. There is no right age for supplements. Children as young as 7, 8, 9, 10 are being diagnosed with anemia.
Yeah.
So they are also being advised supplements.
Yeah.
Again, it's because of the eating habits, no exposure to sunlight. We go out with sunscreen, we go out in AC cars, we go out with hats and gloves, and so vitamin D kahan se banega? So you are going to be deficient in all of this. Again, the next thing that you asked was osteoporosis, so lifestyle.
We're not exercising enough.
Not just exercising. So, if there is a mixed population, if you go to let's not go outside, we are in Punjab, है ना? आप किसी पंजाबी वेडिंग में जाओ, जितने भी पिंड की नानी, दादी, बुआ, they are going to have an erect spine compared to people living in the cities. Why? The trends have changed over the years in the kind of practices, the kind of home practice. वो खेतों में काम करते थे, whether it was their compulsion, whether it was out of choice, whatever. लेकिन again another question is like, why should women do weightlifting? Because you don't understand that bone is formed by compaction. So a very simple thing is कि अगर आपने रोटी को दबाया, आपने उसका फुल्का बनाया, that is an example of compaction, and bone is formed by layers of compaction. So if you're not going to be doing any kind of weight bearing in any form, we get such considerate husbands जो suitcase तक नहीं उठाने देते. So how is your bone health going to be good? So these are the, you know, change in trends, lifestyle, nutrition, no exercise. I do get people like, ma'am, we know we need to exercise, but we don't have the time. What should we do? I'm like, go back, walking from here. That's all I can advise you. Leave your car here, go walking. There's no exercise at all. There's no substitute. You cannot substitute it. You have to do it.
But also, all said and done, there is a requirement of calcium also, I think.
Yes, there is a requirement. You know, I am a firm believer that देखो दूध आता है घर में, अब उसमें उसने कितना पानी डाला है, उस काओ को या बफलो को कितने इंजेक्शंस दिए हैं कि वो एक्स्ट्रा मिल्क प्रोडक्शन करेगी. व्हाट इज द क्वालिटी ऑफ दैट मिल्क?
एब्सोल्युटली.
पनीर हम देखते हैं तो ये पता नहीं है कि ये इससे बनाया है या उससे बनाया है, समझ नहीं आता खाना भी है कि नहीं खाना है. सो व्हेन यू टॉक ऑफ द क्वालिटी ऑफ न्यूट्रिशन, इट इज नॉट वेरी हाई. आई विल नॉट से लाइक गुड बैड, इट्स नॉट वेरी हाई. सो ऑफ कोर्स the only way you come to know you need supplements is your body gives you sign. You don't need to go to the doctor. अगर आपका fatigue level है और you know you perpetual tiredness कि उठना ही क्यों है, काम ही क्यों करना है, बस you take 2 flights of stairs and you're all tired. Of course, lack of exercise, but your body needs nutrition.
And this is also from I think if the food you are taking, diet you are taking is carb rich, again you have that energy spike and then sugar level falls very quickly, and that again makes you tired. Whereas having, like you said, protein rich food or maybe equal or right amounts of protein and fiber, it keeps you full for longer times.
Yes, it keeps you full for longer times. It gives you fruits have a lot of vitamins, so that is very important. आपको water का intake भी मिलता है, because like we always say to the patients, it's better to have maybe a bowl of fruits rather than a glass of juice, because उसमें आपको सिर्फ you get the liquid, you get a little bit of pulp, but आपका फाइबर जा रहा है, बहुत सारी like you know those are important things which you give that satiety. You have the limited amount which gives you a punch of everything.
And you are also talking about strength training. That is also one big thing we keep hearing. If you ask a lot of women will say, हाँ मैं जिम जाता हूँ, कार्डियो करता हूँ और वापस आ जाता हूँ.
No, that because they don't understand that, you know, gymming is not just about losing weight.
Yes.
It's about building your muscles. 2, it's about building your bones. If you are going to age, आप externally age कर रहे हो, agreed, your bone is not going to become stronger after a particular age. The decline in the quality is going to be more than the formation. And only way of improving bone health is आप कैल्शियम खा तो लोगे, लेकिन वो उसमें इनकॉर्पोरेट कैसा होगा?
So
that is going to be through weight bearing exercises or what we call as the strengthening exercises. And that, चलो, if you don't want to do it at the gym, you do it at home. But हम घर पे भी नहीं करते हैं. We are the privileged people nowadays. We really are. Like I said, I do get, you know, after the delivery वो फाइल भी नहीं उठाते हैं. Husband baby भी उठाता है, फाइल भी उठाता है, बैग भी उठाता है. वो सिर्फ चल के जाते हैं. I mean, I'm not saying that's bad. That's very good. But you know, it's an example of how limited activity all of us do these days.
We talked a lot about, I think, I would say general life of women, but nothing, anything specific. Like, do you see a lot of during pregnancy? Do you see people needing specific supplementation?
Yes, during pregnancy, of course. The most important thing is that even in today's time, I come across patients who don't start taking folic acid.
Is it a form of iron?
No, it's a vitamin. Folic acid is a vitamin. And if you will talk about the textbooks, they say that it has to be started at least 3 months before you get pregnant.
Okay.
And it is a very important vitamin because it prevents formation of birth defects in babies. So in today's era where you have so much knowledge on the net, where you can just, you know, type the word folic acid and you will get like thousands of articles. But I do get people who have still not started taking folic acid even up till like 6-7 weeks of pregnancy. And the first 3 months, or you can say even up to like 10 weeks, is the time when majority of these vitamins are required, because the baby's basic structures are formed by then. उसके बाद में आपको कुछ भी करना है कर लो. That is the time when the major insults can result in defects in the baby. So number one is folic acid. This is important. Two, of course, we have to start iron and calcium. Some people start it early, some people start it late. Normal time to start it is somewhere around 14 to 16 weeks. Then there is something which is important, is DHA, or omega-3 fatty acids. Now, why are these important? They are important for the growth of the neurons, the eye development. They're important for heart health, overall growth of the baby. Majority of these sources are non-veg. When you talk of DHA, like fish oils and all of that. Like you said, that vegetarianism is the right word, is on the rise in India. So how do they get it? Not necessary. Please, आप मत खाओ DHA के capsules, but like various seeds, जो
flaxseed oil.
Yeah, flax seeds, chia seeds, pumpkin seeds, जो तरबूज और खरबूज में जो बीज मिलते हैं, जिन्हें पंजाबी में मगज कहा जाता है. All of these can be included in your diet. The basic forms. Then
actually,
a lot of
I'm just remembering in southern parts of Maharashtra and also northern parts of Karnataka, you fry pumpkin seeds and then you have it as a snack.
वहाँ पे से चटनी भी तो बनती है.
चटनी भी बनती है.
Yeah, that way. And another thing about supplements is that a lot of people get cramps. Leg cramps are very common in pregnancy. So vitamin B12, it is a vitamin which is not stored in your body for very long. Because of the cooking practices, it is heat labile, it is destroyed. Vitamin D, because of less exposure to sun, and also there is a increase in the demand in pregnancy. And when you talk specifically of cramps, women are prone to leg cramps in pregnancy. So magnesium supplements are very important.
This is something that is coming up again and again. That Dr. Randhawa is our principal medical advisor at GNC India. So we are now developing a product that will be launching soon. So we are developing a creatine with electrolytes, because a lot of people who go to gym, they are sweating. So you lose electrolytes. So we initially put in typical electrolytes: sodium, calcium, potassium and chlorine. 4 electrolytes.
Like the sodium chloride, NS solution.
NaCl, then KCl, and then of course calcium. Calcium, I think, is calcium oxide. I'm not super into, but I know that it's there. Now Doc Saab says, ये सब सही है, but you need magnesium. I said ki, doctor, who cares about magnesium? Nobody even knows magnesium. He says magnesium is the super electrolyte. It is required for heart health. It is required more in women, and if more women are taking strength training, or even if they're doing gymming, or even if they're not doing it, right, and creatine anyway is helpful for muscle, you put in magnesium. And actually it was a huge task, because stable form of magnesium which can be there in the product, it's super tough for the R&D team. So they took almost a month, but we figured out. But when you're saying, I'm just realizing magnesium is one such element. I think it's coming everywhere. People are saying, oh, you're feeling stressed, you need to have magnesium. You have some reproductive issues, you need to have magnesium. You have issues even for male reproductive systems like sperm motility and all. People are saying magnesium is super critical. It's emerging as a super element now.
You're right about that, because magnesium, it is like all the systems that you mentioned. Let's start from our brain, because Dr. Saab is a neurosurgeon. Fine. So magnesium is important for mental clarity. If you're too fatigued, too stressed, it's important for that. Again, a lot of work is being done by people on memory. So it was basically, if you're unable to fall asleep, so magnesium can help to treat insomnia also. Of course, like you mentioned, that which type of magnesium. So there are certain salts like magnesium glycinate is very important for sleep. So if you have patients, अगर आपको medicine लेना पड़ता है, फिर वो तो आप particular salt ही लोगे. Then when you come to the heart, it is very good for heart health also. When you talk of females, it is a muscle relaxant. So you are looking at it from the point of view of muscle and nutrition. In fact, it is one of the oldest drugs used in gynae and obs practice, because it helps to lower blood pressure during pregnancy. So when we have certain high risk pregnancies, when the mothers have very high BPs even on medication, so it is used as an emergency drug to save the life of the mother and baby in an injectable form. It is such an old drug. So it is a smooth muscle relaxant. It helps in lowering BP. It helps in menstrual problems. It helps. It's a mood stabilizer. It reduces the breast tenderness. There are multiple uses of magnesium, and when you talk of females, like I said, it helps to relieve the cramps and spasms. So a lot of females experience leg cramps, calf cramps during pregnancy. What you can also call as the restless leg syndrome. So magnesium helps in that also. I mean, I have seen patients whom I do prescribe magnesium for some time. They do come back saying that yes, we can sleep peacefully now. It's very important.
Since we're talking of sleep, sleep is another, I think, silent endemic. Nobody is sleeping properly nowadays.
Yeah.
Are you seeing a lot more people coming and asking, Madam Coach, sleep? I'm unable to sleep. We have a lot of insomnia. Can you prescribe us something?
Disturbed sleep.
Yeah.
And when you say sleep, I slept like a baby. I don't know. I think only babies sleep like that nowadays. Adults really don't. But again, the screen time that we have.
Yeah.
The events or how your day passes.
Yeah.
There's so many stresses any which way. I mean, living in today's time is a stress.
So it's also elevated cortisol and not
Yes.
enough melatonin that is there.
So I was just going to come to that. When you're, pehle ke abhi tak, the oldies, not exactly oldies, but the senior members of the family will not sleep without a glass of milk.
Yeah.
Why? Because it helps to release melatonin, which helps you to fall asleep. So instead of taking a glass of milk, we'll pop a pill. So,
We are lactose intolerant now.
yeah, right, absolutely. So now we'll have to form vegan forms, yeah.
Yeah. So there is we sell whey protein, right? And there is so much demand in the market now कि we want protein but not from milk. We want plant protein. Because it doesn't taste great, and whey protein has the right amount of all the essential amino acids, the right profile, and it is from milk. But no, people are even there, we want highly processed. If you are giving us whey protein, it should be in isolate form, which is lactose free, which is carb free. Why do you want?
So don't you get messages from mothers that why are you making our children eat milk protein and not advising milk?
No, we say that you have milk,
Yeah.
but instead of having maybe a liter of milk, if one scoop helps you, I think that's also a good idea to have it.
I'm just joking.
So I think we spoke a lot about infertility, pregnancy, general health. One other thing that's now coming up, I think again in conversations is premature menopause. Are you seeing it? And again, is that again related to your insulin resistance and PCOS and all?
No, premature, this is like premature ovarian failure or menopause. It is, yes, it is on the rise. I will not say menopause but failure, because what it means is that the ovaries, in females, you don't get that unlimited supply of gametes like the sperm. You have it's a limited number of eggs which has been predetermined in your genetic makeup. That lasts maybe only till the age of 35 or some cases up to 40. Again, between 35 to 40 and beyond, even if you do have the eggs, the quality of eggs declines. And there is an increase in the number of syndromic children, or like you say, special children. They might have certain disabilities. So cases of premature ovarian failure are definitely seen more commonly now. First of all, it was not even recognized previously. पता ही नहीं चलता था कि हुआ क्या है. So now, of course, it is there, and there are multiple factors. If you've had any kind of exposures, cancer treatments, it runs in the families also. Ki someone's mother or someone's sister had similar issues, and then it was diagnosed that they're unable to conceive because the ovary has stopped producing eggs. There's a misconception that if you continue to get periods, you continue to get pregnant. It's not like that. The eggs are going to result in a pregnancy, and once the number of eggs is exhausted, you cannot get pregnant, but you can still keep getting periods till you attain menopause. Now the standard age for menopause according to textbooks has gone up to say 50 to 53. Earlier people would experience menopause even at 45, 40. Now the age has even gone up to, sometimes I get patients of 55 also that we still have not attained menopause. So getting periods is different from being able to produce children.
Understood.
Yeah.
Understood. So we're talking of ovarian failure.
Ovarian failure.
Okay. And that's again coming from stress and all these disorders, or again, can that be corrected, or
So
what are those things?
Stress is definitely an important factor. The reactive oxygens, these are very sensitive tissues. So any kind of oxygen reactive species or the oxidants that we say, they're going to act on your gametes. Plus, like I said, certain types of treatments also. But now when you do get certain type of cancer treatments, we do advise the patient, that can be a male or a female, to do preservation of their gametes. It can be sperm or it can be ovary. We have progressed so much that we can preserve the eggs in their nascent form, and once the person has decided to get pregnant, you can utilize those eggs in the form of ICSI or IVF treatment to get a pregnancy. So
Understood.
Again, when you talk of premature ovarian failure, like 35, 40 is fine, but marriages are occurring late. Career keh lo, whatever, change in trends keh lo. So if someone is getting married only at the age of 33, 35, so we know that there is a decline in fertility after the age of 35. So that could also, we can put it that way also. But anything before 40 is definitely premature ovarian failure. 30, 35, yeah.
And this cancer thing, the terminal thing is coming up again and again in our conversation. Is it really on the rise right now, like lifestyle conditions of diabetes and hypertension? Are we seeing a lot more cancers now?
Yes, we are. And one thing is that they are being detected early. Like, just today, I got a report of an ultrasound. A patient just walked in saying that I have a lump in my breast, which is painful occasionally. And then I asked her to do a mammography, and the mammography report suggested that she has a lump of somewhere around 2.5 to 3 centimeters, and it is advised that she undergoes a biopsy. I'm not saying she has a cancer, but this is just an example that she thought I have a problem. It might turn into cancer. She came to me. Normally, पहले females क्या करते थे? चलो दुखता ही रहता है, प्रॉब्लम तो चलती रहती है.
They might be confusing it as benign thing.
They might be confusing it कि कुछ नहीं हुआ है, मुझे weakness हो रही है, मैं ठीक हो जाऊंगी. I need not do anything at all. So the only thing that is important now people are realizing is that if you have a problem, get it evaluated. It's not necessary that it will be a disease. If it is a disease, so the saying goes, a stitch in time saves 9. But at least you need to take a step forward that, do I really have a problem? So definitely awareness about screening tests and the open mindset of coming forward with a problem, which might be just very minute, which might be big, is causing early detection of various cancers. And environmental exposures, pollutions, adulteration of various kinds of foods with artificial hormones, all of this definitely is causing cancers.
There are two things we'll talk about before we kind of close this. One is there's this trend about anti-aging and youthfulness, right? Are you seeing that? Are more people coming to you saying ki my skin has become saggy, should I do something? Or saying ki what should I do to stay young for a longer period of time?
Who doesn't want to look good? Everybody wants to look good, and there has to be no age that anybody can define. It's your choice. You might want to look beautiful at the age of 60. You might want to look beautiful even at the age of 70. I mean, it's a personal choice. So yes, of course, there are a lot of people who do have such concerns, and there are again various types of trends that are being followed. You might not always go for a treatment. Okay, there are various exercises, but again, there are various levels of progression of a problem which can be solved at various. So you do have exercises, you have topical creams and application of various products. You have minimally invasive treatments in the form of Botox. They just give you minute form of an injection which paralyzes your wrinkles and your muscles, which gives you the youthful appearance. There are various forms of laser treatments that have come up, and the basic principle of these lasers is that laser is a very safe form of treatment now. It is FDA approved for various kinds of treatments. So it's just causing you stimulation of collagen, and collagen is the backbone of your tissues. So it gives you that supple appearance, and your muscles look a little more pinched up. So they are there. Then if you want to go for surgeries, of course, we know there is a lot of scope for surgical correction of various problems. I would like to talk about one thing, that is something about urinary incontinence. So there are various aspects of being youthful. So externally is the way you look, how your muscles are, or how your face is looking. But one problem which females face with age due to weakness or due to various kinds of activities is urinary incontinence. And again, there is a shift in the urinary incontinence also. Normally this was a problem which was encountered in females around the age of 60, 65 because of long standing diabetes, because of various other medical comorbidities. Now even at the age of 45, you can say 40 also, people have started experiencing urinary incontinence to the extent that they will come forward that we went to we were out at a party and we were dancing and we just did a step and we laughed loudly and there was some leakage of urine. Or we went to the gym and we tried to do one particular exercise and there was leakage of urine. Now earlier people would blame it on normal vaginal deliveries because that is a traumatic experience which causes a lot of stretching of your vaginal muscles, and particularly not much attention is paid to regaining that muscular tone because nobody really thinks about it. So nowadays, if you will talk about the percentage, I think 70% people are delivering by cesareans, whatever is the reason. Is there a fetal indication during the labor process or maternal request, whatever. So even those 70% of females are experiencing urinary incontinence. Again, no exercise or limited exercise, sedentary lifestyle, weight. When you gain weight, the fat is deposited in between your muscles. So it hinders or it interferes with the normal activity of your muscle contraction. So these are some of the very basic reasons that cause females to experience urinary incontinence.
One subject that we don't see a lot of conversation in India is about sexual education. And at least in male sexual health, there is a lot of awareness. People are now talking about probably premature ejaculation or probably something around arousal issues and then other things around that. But we don't see conversations happening on the women's sexual health side. Are there issues, or is it like, okay, there are no issues, we don't need to talk about it?
There are issues, and one thing about when you talk of sexual education or sexual health education, this is something which should be started in schools. Even now when we go for talks in schools, the girls are made to sit separately, the guys are sent off into the field to play something. Maybe they are young, maybe they will laugh and sometimes ridicule that what are they talking. But instilling this at a young age, they're not like very young, they're in the age of like 9th standard to 12th standard. You need to sensitize the opposite sex to the demands of one sex, number one. So it should be started at that age. Even before that is when your parents, your mother talks to you about it. That can be a boy or a girl, because it's not that a girl is going to menstruate, but a boy is going to be a husband, a boy is going to be a brother. So that sensitization is important in the family. Then when you grow up, there are a lot of problems which females experience. The most basic is something called as vaginismus. Vaginismus is inability, or the female is unable to allow penetration due to a reflex involuntary contraction of the muscles of the vagina. So this is when you talk about it, it might seem like a very small thing, and when you really talk about it in the essence of the factor, it is also reasons for broken marriages.
The problem is nobody is talking about it.
Exactly. And you need not do rocket science to treat vaginismus. It's simple counseling. It's something like a couple therapy. The male partner is not suffering it from the problem, but the male partner can actively participate in the treatment. And moral support is important, because inability to for consummation of marriage is a very big thing for whichever culture you talk about. So one problem is definitely vaginismus. Next is lack of libido or loss of libido. Another problem that females experience are something to do with sexual dissatisfaction or things around that. But again, it's never spoken about. That way you are right that very few women will address this problem or come forward with it and want to talk about it. This can happen around after a delivery. This can happen after a traumatic experience. Some people are very unfortunate to have undergone some event in life which creates a very bad mental scarring, and when this is something called as a post-traumatic stress disorder, in which they definitely experience this. Another time is around menopause. So if you've attained menopause at the age of 50 or 55, a lot of females experience problems of vaginal dryness or persistent itching, or again loss of lubrication, because of which sexual activity or intercourse becomes very painful and traumatic. And all of these are things which can be managed or treated with very minimal, like you talk like over the counter medication. It's nothing that you need to undergo a procedure. आपको बहुत कुछ करना पड़ेगा. It's just about coming forward and then just being open minded about the treatment. That's all it needs.
And that reminds me, I should tell you, we were studying the US market, and on Amazon, the best seller or the highest seller in the space of wellness, not just sexual wellness, but overall wellness, are supplements which are vaginal probiotics. You'll be surprised. I think then I thought, okay, US has so much awareness that people are talking about probiotic ecosystem in the reproductive system. They have advanced to such a scale, and here we are where we joke about, we have so many movies where these sexual problems are made fun of, and there is no talk or no conversations, serious conversations around these issues.
There's another thing I would like to, since we're talking about it, contraception. It's always thought that contraception is a male choice. It's absolutely wrong. Contraception is a female choice. Of course, if you want to plan a family, and if there's some discordant thought that's going on, that's a different thing. But so many people just will regret later that, why didn't we use a precaution? Of course, it's a couple thing. They come as a couple, but the female has to bear the brunt of it. Whether you're doing it by tablets, whether you are undergoing a surgical procedure. So if you have made up your mind, or because of the change in the trends, I'm not doing any moral policing here, but there's a change in trend. So if you're not at the right age or right time to get pregnant, it's very important to use contraception. And when you talk of vaginal probiotics, these are also very important from, of course, vaginal hygiene, because vagina is an area which is populated by a lot of organisms. It's not a sterile zone. It's just that the good organisms have to be on the higher side and the disease-causing organisms have to be on the lower side. So that balance has to be maintained. So that can be maintained by your lifestyle, one of which is probiotics. Now, when you talk of probiotics, aap bhale hi dawai mat khao. Vitamin C is important for immunity all over the body. So vitamin C products are important for vaginal health also. Sweet lime, dahi, yogurt and dahi.
Fermented foods.
Exactly. They are for the gut also, so sorry. So they are, and it prevents infections, it prevents infertility problems, because persistent infection is going to carry forward into your uterus and fallopian tubes. And of course, so
I don't know, I think I get it. I think we don't talk enough about gut also, because you're bringing it up. And then there's a gut doctor on YouTube, Dr. Pal Manikam. I don't know if you have seen his videos and all. He says everything in the body, whatever is happening, if you kind of solve for gut, everything will take care of itself.
I think he's not wrong in saying that, because if bloating, gases, constipation, or irregular bowel habits, indigestion, people will Dakar aata hai ji. Ab Dakar to aayega hi, because there is a problem with your forward tract. So it's not something to laugh at, but yes, they are very disturbing for people who suffer from them. So
I think any parting thoughts, ma'am? From my notes, I think what you're suggesting is have good food, then exercise well, then have great sleep, and things will automatically take care of themselves.
Yes, great sleep is very important, because in today's time, a lot of mental health issues are there. So yes, I talked about nutrients, I talked about pregnancy, I talked about infertility, but a lot of problems regarding depression, anxiety disorders, the coping mechanism is not that good. So it's a healthy mind in a healthy body. So I think we've spoken a lot of how to stay healthy, but in the end you have to make your own right choices.
I'm leaving with a lot of questions. Please let me know when we can do this again.
Most welcome, anytime.
Thanks a lot, Dr. Balvin.
Thank you so much.